Welcome back, everyone, to OpenLine. Good discussion tonight. We are talking about long-haul COVID. So many people impacted by this. We have with us Dr. Sapna Kripalani from Vanderbilt. She's an assistant professor of medicine at Vanderbilt Medical Center, joining us via Zoom. And it's good to have you on and getting some good calls. I want to just keep going through calls as we get them. We have Irma on the line. Irma, hello. What is your question for the doctor?
Hey, y'all. Yeah, Dr. Kripalani, listen, I've got a couple of questions here. I don't know if they'll kind of tie in or not. But, I think I had COVID in August of 2019 because I had the exact same thing last August. It started 2021. And Dr. Hildebrand from Meharry said that anywhere in your body that you have inflammation, you have these ACE receptors that the virus is looking for to live in and everything. And I'm just wondering, you said that y'all are studying the gut as a possibility. If it has like a variant where as it's mutating, it sets you up for the next thing coming down the pipe when it mutates, and you can't stop it. But what I wanted to ask you about is I heard on NPR about a study at the Methodist University in Texas, where they're looking at how COVID, and this is one of the things early on all you guys were talking about, how COVID damages the vascular system, and how it destroys these cells that allow your vascular system to be elastic, where they'll expand. And they were saying that it looks like that, and I've been through this, you're okay until you kind of stand up, get moving around, and then you have to sit down again. And they're thinking that since your veins don't expand, you're not getting enough blood to your organs and stuff. So looking at nerve damage and circulation, I know that nerve bundles and stuff like that, I've been told by my doctor, need a lot of blood to survive, and your organs do too. So I'm wondering if it's something that COVID has done to the inside of your arteries where they can't dilate like they normally do. Because, women, when we go through menopause, before 50, more men have heart attacks. After 50, more women, and they said that's estrogen-based because of elasticity. So can you speak on that study if you're familiar with it? And right, I don't want to sound like I know what I'm talking about, but I'm really curious. I think that's my issue. Thank you.
All right. Irma, thank you. All right, go right ahead, doctor. You might be muted. Oh, wait, there. Okay, go ahead. Sorry, I didn't hear you. Go ahead.
That's okay. I'm not familiar with that exact study that you're talking about, but I do know exactly what you are referring to, and that's a condition called POTS. POTS, P-O-T-S, is what we call postural orthostatic tachycardia syndrome. And what that basically means, it's a condition where it's a condition that's existed for decades. It's well known, well studied, where people are not able to maintain their adequate blood pressure. So what we have found is that COVID infection seems to trigger a POTS response, and it has to do with the virus maybe attacking the nerves, attacking the blood vessels themselves that keep them from being able to not dilate, but being able to constrict and keep blood flow to the important organs, most particularly the brain. And in particular, when people are changing positions quickly. So if you stand up very quickly, and most of us have experienced that moment of a little lightheaded. Well, imagine if that lightheadedness doesn't go away and gets worse and worse and worse, and you get dizzy and lightheaded, and in some cases, people pass out. That's what we're seeing in long COVID for people who are experiencing POTS related to that. So there's actually a lot of studies going on. I'm not as familiar with the one going on at Texas, but there is one going on right here at Vanderbilt looking at that exact thing. And our researchers in our autonomics clinic are studying that intently because they have been seeing lots of patients. I know I've been referring lots of patients to them who have these symptoms. It's challenging. It's always been a challenging condition to treat. Some simple things to do if you feel that that's happening to you is to make sure you're really staying well hydrated. Fluid is the #1 treatment for that condition. And that's what they tell everyone is make sure you drink a big glass of water first thing in the morning when you get up. If you're feeling lightheaded or dizzy or feeling like you might pass out, you want to stay very, very well hydrated. Another simple thing you can do if you have any leg swelling is you can wear some compression stockings. That seems to help a lot with this type of POTS syndrome. And it has no side effects. Water and wearing a nice tight pair of compression stockings have no negative side effects, but they can really be effective at curbing those symptoms. So that's something simple you can do at home. But secondly, be sure you talk to your doctors if that's happening, because that is a very real, serious complication of long COVID.
Irma, thank you for that call. Let's go to Diana. Hello, Diana.
Yeah.
Go right ahead. What do you want to ask the doctor?
I have a question for the doctor. I hope that I can understanding what she's saying. Now, I just got my last booster shot before they came out with the Omicron one. I had gotten that a couple months ago. Now, am I to understand that I can take the Omicron one 2 months since I've taken the last two?
Okay.
Is there a 2 month span in between the last two that I've done?
All right, I'm gonna put you on hold. Okay, what about that? Do you understand that question?
I do. Yes.
Could you help me understand that question? What is that? What does she mean?
So I think what I heard Diane say is that she just recently had the most recent COVID booster, not the new one, but had her maybe 3rd or 4th dose of the original COVID booster. And now, as of the last week or two, this new bivalent vaccine has become available. And so my understanding is that she's asking, does she now need to wait a couple of months, and is it okay for her to get that get that next booster in a couple of months? So just to clarify, you don't have to wait that 2 months, but right now experts are recommending that you do, primarily so you get the most effect from that next booster that you get. The thought is that every time you get a booster or every time you get a natural infection, your own immunity is going to be revved up. Your antibody levels are going to go up. Your body's going to prepare itself to fight it off if it gets exposed again. When you just had a booster, you're likely to have higher levels of antibodies. It's not 100% effective against the Omicron, of course, but you still have higher antibody levels. And so the thought is that if you delay that next booster a couple of months, you're going to maximize the benefit you're going to get from the booster itself. Since we know the antibodies wear off, we're trying to spread it out as much as possible. So rather than get a double whammy back to back, you're better off spreading it out so you get more prolonged protection.
One of the things I've heard over and over is the fog associated with long COVID. The memory issues, the fog. Talk about that. I know you said there are many, many symptoms, but what do you see with that? How common is that? Is that the most common or not? And how severe can it be? And I guess tell us as much as you can about the fog associated with COVID.
No, that's great. I'm glad you asked about that, Ben, because that's one of the things that it's hard to understand unless you're living in it. It's a very debilitating symptom and quite traumatic because it affects your ability to really think clearly, to put thoughts together. It affects people's ability to speak. You can imagine if you're in a position where you have to do a lot of speaking or presentations and you can't get a thought out clearly, it can really affect your self-confidence and how you feel. But the fog is a feeling of just lack of clarity. It's being confused with basic things that you need to do. For example, if you had to get up in the morning and get dressed, most of us can pretty much go through those steps without putting a whole lot of thought into it, right? You're kind of on autopilot. But imagine having to think very carefully about how to get the toothpaste on your toothbrush and how do you brush your teeth to make sure you get every tooth, and to think about how to put your shirt on, and to really have to think about how do I get my arm to go through that hole. Imagine how exhausting that would be. And that's what a lot of people are living with. It's a really frustrating feeling because they recognize that this shouldn't require this much energy, but it takes a lot of thought and a lot of energy just to conduct normal basic things. But the cognitive brain fog can even lead to stuttering. I've seen people have issues with their speech where they not only can they not get a thought together, but even when they do, their speech is actually affected. So that's where, the interventions such as speech therapy and some of actually there's some new studies going on interventions to help people relearn how to multitask and how to carry out their regular activities can be really beneficial. But that's probably one of the most upsetting symptoms that people report.
Yeah, what you just described is horrible. That is very scary. I know also there are support groups. Is that right? And how effective are those? And when would you recommend somebody be part of something like that?
Yeah, I think the support groups are one of the greatest things that have become available. And there's so many different kinds. I know at Vanderbilt we have a virtual support group that you can get plugged into if you're part of the long COVID clinic. But there's a lot of other online resources as well that people can get access to. There's online support groups. I think one of the important things that can provide is really a sense of not being alone in this. This can be a very isolating condition, and people often feel like they're the only ones that have this. They don't know anybody else who's dealing with symptoms as profound as theirs, who's going through the same struggles that they are, who can really help them and for them to not feel like they're going crazy, and to have other people who say, I know where you are, I understand where you're coming from, I have been there, can just be incredibly validating, and to be able to hold their hand through it and say, this is what I did. I really think that just from a personal standpoint, it can really provide a lot of support. So I highly encourage people who are suffering from these symptoms to get plugged into a support group if that's something that is appealing to you, because I really think it can help a lot.
All right, we are going to take a break. We will come back, continue our discussion. If you want to call in, there's the number. One last chance, one more segment, 615-737+. We'll take a break. Be back right after this.